Hi, everyone. Welcome. My name is Brinley Cons, and I'm the founder of HS Connect. And today we're here with Dr. Lauren Orenstein, who is a dermatologist at Emory University. And she is an HS specialist with a focus on HS in her clinic. And she does see all ages of HS patients, including kids. So she is joining us here today to talk about HS in the pediatric population. Thank you so much, Dr. Orenstein, for joining us. I really appreciate it.
Thanks so much for having me. It's my passion to help take care of patients with HS and anything I can do to help increase awareness in the community.
We appreciate it. So we're talking today about a study that was just published not too long ago, and it looks like it was a study of 481 pediatric patients, and kind of covered a lot of information in that study. And I was hoping that you might be able to give us kind of a broad layman's terms version of what the study was and what information it captured.
Absolutely, I would be happy to. So the article that we're discussing today was just published in JAMA Dermatology in February of this year. It was written by Li Wang and co-authors and is titled Hidradenitis Suppurativa in the Pediatric Population, an International Multi-Center Retrospective Cross-Sectional Study of 481 Pediatric Patients. So yes, a big mouthful. But this is really exciting because it's the biggest study that we have to date of pediatric hidradenitis suppurativa. This was an international collaboration between 10 different 10 different dermatology clinics. And what they did was they identified 481 patients, as you've mentioned, Brinley, who had pediatric onset hidradenitis suppurativa. So that means these were kids who were under age 18 and had a diagnosis of HS. And what the study does is they do a really good job of characterizing these cases and describing what was going on in these particular cases. So their major findings were that most of the patients were female, about 80%. That lines up pretty well with what we know of HS in the adult population. They found that there was a clinically important delay in diagnosis for these kids. So on average, these kids had symptoms starting when they were 12 and a half years old, but many of them weren't diagnosed, or the average age of diagnosis was at about 14.4 years old. So there's about a 2-year delay in diagnosis for these patients who had in fact been diagnosed. You know that there must be a lot of people who weren't diagnosed yet and are left out of that group. At the time of their first dermatology evaluation, over half of these patients were either early stage 2 or early stage 3, meaning that there was already some degree of clinically apparent scarring when the patients first came to a dermatologist. And they also looked at comorbidities. That means other diseases that were present and associated with HS, and they found that the most common comorbidities were having an above normal weight as well as acne. So for me, some of the takeaways from this were, one, that there's a clinically important diagnostic delay in pediatric HS, and that under treatment during that time when it's undiagnosed may lead to progression of disease. And so to me, that seems like a very important window of opportunity for us to improve outcomes for kids, is to educate our colleagues, educate the community, and help make sure that this is picked up earlier. And then the second important takeaway for me was that there are some comorbidities that seem to be associated with pediatric HS. I think more work is needed to evaluate those comorbidities and make specific recommendations, but it's just important for a pediatrician to be involved in these kids' care and following them longitudinally so that they can help manage any comorbidities that arise.
Yeah, it's interesting that you mentioned, the male versus female ratio in there too, because we were I just submitted an article for the website too, talking about how in North America, it seems to be a difference between the male and female population as opposed to other countries, that in some cases men are more afflicted with HS than women. So I was fascinated by looking at the research on that, but seeing the trend continue kind of in the US. So it was interesting to see that in there as well, because it definitely did speak to the 3-to-1 kind of ratio that we deal with in the adult population also.
Yeah.
And then you mentioned too the where people were kind of coming from or getting diagnoses from, and that's another kind of focus that we have too, is how we're going to get in front of all of these people who tend to see these pediatric patients. Kind of the same thing in the adult population, in that they're going to ERs for abscesses that need to be lanced. So getting in front of them to try to help curb that. The delay in diagnosis is going to be really key too. The more people we can educate, the more people we can, get headed in the right direction earlier.
I agree with you. And I think one thing that was interesting in this paper was they said that I think 22% of patients had been to the ED for their symptoms. But in terms of where those referrals were coming from to get people hooked into dermatology care, only about 5% of the referrals were coming from emergency departments, suggesting that there may be that may be a nice place to intervene and a nice opportunity to educate.
Yeah, and typically they're seeing them as a one-off, for a single abscess that is really problematic. And obviously when you're not returning to the ED for reoccurring issues most of the time. So it makes perfect sense when you think about it from that perspective, but then that poor person or child who just is going through that without, just kind of fumbling through is really difficult to know. And you had mentioned in the beginning that most of them were stage Hurley 2 or 3, Hurley stage 2 or 3, excuse me, before they were actually seen by a dermatologist for any kind of treatment, which is really fascinating because it does prove that there's so much disease happening rather quickly in some cases, even though it may only be a delay of treatment by a couple of years, but that you're already having the scarring before you've even had a chance to see a dermatologist. So what does that look like for a dermatologist to come into when you have a Hurley stage 2 or 3 at that age? What do you look at as a dermatologist to kind of decide what treatment plan to go with when you see a patient who's already at that juncture?
So I really think that a lot of this ends up, at least in my experience, is very much tailored to the individual patient and parents' preferences. I do think that we're starting to accumulate more data that it's important that we treat HS with strong enough therapies early on to prevent progression. But at the same time, I often find that when patients come in for their first time, they may not quite yet be ready to start a biologic therapy. And so I see my role as being one of educating the child and the parents about the spectrum of options. And I will try to explain to them what I think are options that have a reasonable shot of getting their HS under control. And then just trying to make sure that they're coming back in regularly over time and that I'm helping supervise and make sure that that process is smooth for them. Basically, we want to give any treatment about a 3 to 4 month chance to help. And then if it's not helping, I want to make sure that my patients are getting the opportunity to move on to new treatments, that they're not just stuck. So I think as a provider, my role I see is being mainly education and paving the way for more treatments. But sometimes it takes a little while for the patient and the parents to want to move forward with therapy. And that's okay.
Yeah, that's definitely true, especially when it's someone new to HS, because you don't know what direction necessarily to head in as a new patient or a parent of a patient.
Absolutely.
So it's kind of overwhelming at first to figure out, which direction to head in, definitely. And you'd mentioned in the study that it noted there were 41%, I believe, of patients that had a family history of someone having HS.
That's right.
Is there much in the way of studies done on familial links and genetic links like that, or what does that look like in the world of HS?
Sure, there have been some, and that's a great question. There have been some studies, and this is pretty in line with other studies of pediatric HS that show with childhood onset HS, on average, about 40% of people have some sort of positive family history. There have been genetic studies looking at HS, and there have been a handful of genes that are actually linked to hereditary HS. But But the majority of people who have a positive family history don't have any of these genetic mutations. And so it's really still unclear to what degree is that familial predisposition, to what degree is it truly genetic, and to what degree is it associated with other environmental factors. And it's probably some very complex combination of the two.
Yeah, that makes perfect sense. It's really interesting to hear that 41%, because that seems like an overwhelming amount. I mean, it's definitely not the majority, but it's a pretty significant amount. But that they are, in the other studies, it doesn't necessarily show that same gene defect, which makes you wonder, okay, well then what is going on? You know, that's very interesting. As far as hormonal imbalances, so talk to me a little bit about that. It noted in the study that compared with adults with HS, that children tend to have hormonal imbalances, which I think in some cases would be expected given puberty and the time of their life and all of that. But what does that look like as far as how should parents be aware and potentially have discussions with their provider about those hormonal imbalances to find out if that is a trigger for their child?
Great question. And I think from my perspective, I think the answer is somewhat unknown. So at this particular study, there were 2 children who had early onset puberty and hormonal imbalances related to that. And then there were kind of a larger chunk of patients who had issues, other metabolic issues. So things like diabetes or high cholesterol and such. I think that this study probably isn't entirely geared to know what are the rates of metabolic disturbances in these patients and specific testing panels that should be done. I think we're going to need a lot more studies moving forward. But I think that the most important thing would be to, particularly for parents who have HS, to educate your kids about HS so that they know what, not so that they live in fear, but so that they know that if these things do start to happen to them, that they have someone that they can come to, that the door is open, and so that it can be addressed early on. When going to the pediatrician, I think then if you're concerned about these symptoms and you're concerned that your kid might have HS, I think it's very reasonable to bring it up and also to mention any other symptoms or things that your kid is experiencing. And that will help the pediatrician tailor their workup and other things that they may or may not need to screen for.
And that brings up a good point as a parent who has HS and now having a child who has HS, it is a very difficult thing to broach. I have never hidden my HS from my child. She has been, after having wide excisions, she's helped bandage me. You know, she knows the good, the bad, and the ugly of all of it. But in some ways, that's also difficult for them because I think they can see what their future may hold. In which I hope that mine looks at me and says like, oh, I can do this. You know, my mom can do this. I can do this. But I think it's scary because there's a part of them that may not want to admit that that is what's happening to them. You know, especially if you have a parent who suffers and really has a hard time with that. So I absolutely agree. Letting them know, like, please come to me. There are, you know, things that can be done earlier than they were for, especially now as an adult when you didn't get any kind of, you know, diagnosis until way later, that now we can kind of do that earlier, especially being a parent of a child who also has HS. So you kind of have a leg up on the competition, so to speak, of knowing what to look for and how to help direct that, definitely. But I do feel bad for them, especially because you don't want them to go through what you've been through. But I hope that I can also curb that in my case with getting her in earlier, seeing specialists earlier, all of that good stuff.
Yeah, I like your message and your point there, and that's a point well taken, is that there's maybe fear and uncertainty as people are starting to experience these symptoms, and especially having a parent, depending on how bad that parent's HS is, that may be scary for the kid too. And I don't want to minimize that and can't begin to imagine what that would feel like for either the individual or their parent. But I also like the second part of your message, that even though there is some of that uncertainty and worry, that there's a lot of hope now. And I think that especially in the next 5 to 10 years, I think we're just going to be developing more and more effective treatments for this disease. So absolutely, I agree with you that helping your child recognize it and helping them cope with it, and the many different ways that you need to cope with this disease, is the best thing you can do for them.
Yeah, and they one of the other things I noticed in the study too was the amount of psychological issues that are kind of comorbidities to HS, and that, you know, especially with the situation that we're in now in the world, and then kids not being in school and everything changing the way that it is. And then I think you throw HS on top of that, and you really kind of have a perfect storm. I think it even, you know, was problematic in the past, obviously, as well, but you take the social element away from that, and the isolation adding into that. And I really think that we have a little bit of a perfect storm when it comes to kids and their socialism, and just the psychology that happens with that, and the amount of mental fatigue for them and everything. I'm just baffled by it. I mean, we struggle here in our house with it, and I think it's one of the things that parents with kids with HS definitely need to be aware of, is that there is a definite higher risk of psychological issues for kids with HS, and we all know as adults how much we've struggled. So, you know, thinking back to when you were a kid and how much you struggled, I always try to keep that in mind when dealing with my daughter, because I of course know a lot more now than I did then, and I wish that she could just have that info without having to go through those trials and tribulations, that she could just suck it up from me, you know, via osmosis. But definitely it's something I want parents to be really, really conscious of. And I think that therapy and any kind of, you know, whether it's talk therapy or art therapy or whatever speaks to your child, is really important to have them involved in. There are so many feelings that come with this disease of, it's basically a self-esteem killer. So it's really important to keep your eye on that with your kids, especially now. So please, parents, do pay attention to that. Pay attention to warning signs that you see. Is there anything you can think of, Dr. Orenstein, that parents should pay attention to, maybe under the radar, that if they're getting any kind of indication?
So I think the key, Brindley, as you've brought up, is to just pay attention and to be aware and to be present and involved for your child. Some early signs of anxiety and depression can be when a child becomes more withdrawn, if there's a change in the way that they normally act, if there are changes in grades, or if they seem to not be getting along with their same friend group as they did previously. I think all of those would be things that are warning signs to me. I think it's something else that you bring up here too, Brindley, is the importance of plugging them in with the appropriate resources. And I think one of those things that you can do is just to talk to your pediatrician and say, hey, I want you to know that depression, anxiety, these things are all associated with HS. And I want you to help me look for those signs in my child, and let me know if you detect anything, so that we can be sure that we get my child the resources that he or she needs if the time comes. Brindley, you are on mute.
Oh, sorry. I think that's a really good point too, in involving all of your people. Find your community, your tribe, whether that be your friends too, who associate with your children, anybody who can kind of keep an eye on it for you as well. Obviously, kids are different with their parents than they are outside of their parents. So sometimes it can be hard to tell what's really going on, because you get that special behavior. But yeah, I think enlisting everyone in your community, in your tribe, anyone who can help keep an eye on it for you is really a good thing, especially if you do sense that anything could be kind of off. So yeah, thank you for, you know, involve those people who do see your child as a patient, because they also have a different set of skills than we do in looking for things. So that is really important to bring them in as well. And there are counselors for everybody. We've gone through multiple until we found the right fit. And I thought it was hopeless at one point, that we were never going to get there. So, it just takes a little bit trial and error, going through people. It's not everybody's a match for everyone else. So just be patient. It'll come.
That can be exhausting when you're not
Yes.
feeling up to it necessarily.
Yeah. The study notes that data is lacking, but it was estimated that only 2% of people develop HS prior to the age of 11, the majority of which were boys. From your personal experience in treating HS, does the 2% sound correct, or are you starting to see more and more children under the age of 11?
That's a really hard question because I don't have a sense of the denominator, meaning I don't know what the general population looks like, and then what is the catchment population? What is the overall umbrella that I'm covering with my clinic and I'm seeing? And truthfully, I haven't been practicing for enough years yet. I've only been out of residency, three or 4 years now. So I'm not sure that I've been really practicing long enough to have a good perspective on that change over time. We definitely need more data to learn and to figure out about this. But I certainly see a number of patients in my clinic with early onset HS, and it does make me wonder a little bit.
Yeah, it's such an interesting thing because there's so many stigmas attached to HS. I think some that are meant to be, based on surveys and research, and then some that just have happened over time. So that's one of the things we're really trying to work on, is figuring out, based on research, long-standing, robust research, are those stigmas really the actual fact, or, is there something else that's coming out that may rebut that? So
it's always challenging because we know that there's underdiagnosis of this disease, and it's very hard to know what you don't know.
Yes.
So at this point, we have a sense of the adults 10 years down the road. How many of them may have had some symptoms when they were a teenager? We can ask, but there still may be adults who don't know that they have the disease. And so it's hard to really capture all of the people while underdiagnosis remains such an issue.
Yeah, and we were talking about that with men in general too, how they don't necessarily, they're not as forthcoming in participating in like support groups on Facebook or anything like that. So are they an under-recognized portion of people because of that, because they aren't necessarily as engaged with the community, so they wouldn't know as many clinical trial options or research or surveys, or is it because that truly is, that they are not as affected in the West as they are in the East? It's really interesting because I don't think anyone has the answer to that, and I would love to know the answer.
I will say as an observation that in some of the studies that have shown populations where HS is more prevalent in men, it seems like smoking may play some greater role. But I agree. It's hard to know exactly. And part of it may be, as you're suggesting, kind of creating a community and an environment where the men affected by this disease also feel more comfortable coming forward.
Yeah, I think it all remains to be seen too, in what comes out in future research, and always fascinated to learn more. And whatever there is, we want to get our hands on it so that we can better understand it, as you guys do. I mean, I've never seen such an amazing group of physicians as I have with the HS physicians. I mean, everyone is so wonderful and willing to help, and just like do interviews like this to just help us get the word out, especially about, pediatrics and HS, and making sure that people are getting seen and hopefully cut down on the diagnosis time and all of that. So thank you so much. I really, really appreciate it. I know the community does as well.
It's very kind of you to say, and I feel very honored to get to serve the HS patients and the community that I do. And you're been a very generous community to work with in terms of wanting to help us partner with scientists, wanting to help us learn more about this disease so that we can really get a better handle on how to make people better.
Yeah, Yeah, we all have a vested interest in it, and it's just amazing to know that we're not by ourselves as patients kind of floating out there. So thank you on behalf of all of us with HS, to everybody who is working on HS. So grateful for it.
Well, thank you so much for this opportunity to come and talk today. This has been really great, and I wish you the best of luck as you continue to spread more news about HS and help the community learn about the disease.
Thank you, and I'm sure we'll chat with you again.
That would be great. Thank you very much.
Thanks,
Brenda.
Dr. Orenstein.